66-year-old Margaret Richardson lives in Northallerton with her husband and her 2 dogs. Margaret has a number of long-term health conditions which, over the last few years, have caused her to make several trips to her GP and to hospital.
I tore my cartilage in the inside of my leg. Then they took a little piece out of my knee, and then they put my leg in plaster to straighten the joint. They took some more things out. Then I got a new knee joint in. My circulation isn't very good either, so I get a lot of pains in my legs.
Margaret has benefited from a new scheme introduced by NHS North Yorkshire and York called Case Management. It's been designed to help patients and their families manage complex health needs and treatments more effectively.
I was getting to the stage where I was getting that fed up. I was fed up to the teeth with myself. I was getting grumpy, and of course if my daughter came I would say, well, it's your fault, you know, and all this and what have you. And she'd say, well, what's it to do with me? And it was how I was feeling.
Margaret was assigned case manager Kathy Parle, who visits her home regularly to help with all aspects of her care and well-being.
It's a new way of working, which is to try and be a lot more proactive rather than reactive. Because traditionally the NHS has sort of waited till people have got ill and then dealt with it, and it's just trying to sort of look at the problems and try and head off problems, if you like. One of the aims of this service is to provide care in the patient's home so they can access the different services they need to keep them well, to promote health and to keep them healthy and keep them where they want to be, which is generally in their own home.
The case management service was initially piloted by 2 GP surgeries in North Yorkshire, including this one in Leyburn.
We introduced case management to this practice because we saw a need for a more coordinated care for some patients who had higher needs than usual, and we were attracted to it by the whole concept of trying to not only coordinate different agencies to improve the health care of patients, but also because the central tenet of case management is to empower the patients, and so therefore hopefully reduce their needs and improve their quality of life as time goes on.
Linking up with partner agencies such as social services is a cornerstone of case management. Sarah Goodinson, a social care coordinator with North Yorkshire County Council, has been working closely with the NHS since the service started.
This new scheme of long-term conditions, it's sort of a holistic assessment that's done, taking into account, you know, their health, their social care needs, the amount of hospital admissions. I mean, obviously it is to prevent hospital admissions, and so obviously working with adult and community services, it's obviously to prevent people going into hospital and keeping them independent at home, you know, for as long as possible.
After being successfully introduced in Hambleton and Richmondshire, the case management service is now being developed across the whole of North Yorkshire. This means more people like Margaret will benefit from an improved level of joined-up care between the NHS and its partners.
She's got the patients, and if you don't understand anything, she will go through it so that you know what's happening and what you've got to take and different things like that. And as I say, she's really good.